All right, let's get into it. Today we are talking about something that almost all of us think of as just, simple gear, crutches. But here's the thing. If you've ever had to use them, you know that walking suddenly stops being this automatic thing you do. It feels a lot less like walking and a whole lot more like, I don't know, advanced engineering. So, in this explainer, we're going to stop winging it and actually learn how to master crutches like the precision recovery tool they're meant to be.
So let me just ask you right off the bat, do you really think crutches are just a simple pair of sticks? Because the truth is, there's a real science to using them correctly, and believe it or not, the stakes for getting it wrong are actually surprisingly high.
And that brings us to the really important part, the hidden risks. Yeah, we all think of crutches being kind of annoying or uncomfortable, but a bad fit can cause some serious secondary injuries, the kind that can completely throw your recovery off track. This is why getting the fit just right is absolutely non-negotiable. So what kind of dangers are we talking about here? Well, first up is axilla pain. And look, this isn't just a little soreness under your armpit. We're talking about compressing actual nerves and blood vessels. Then you've got low back pain, which creeps in when your body's trying to compensate for a bad fit, messing up your entire posture. But the big one, the one that really keeps physical therapists up at night, is catastrophic falls, where you slip and end up with a brand new injury that's often way worse than what put you on crutches in the first place. Okay, so how do we avoid all that bad stuff? It all starts by building a rock-solid foundation with a perfect fit. And we can break this down into 4 essential, non-negotiable pillars. Getting these 4 things right is the key. It's what turns your crutches from a potential hazard into your best asset for recovery. Pillar number 1 is all about your base. Where do you put the crutches on the ground? Well, this isn't a guessing game. The tip of each crutch needs to be exactly 6 inches out from the side of your shoe. Think of it like you're creating a wide, stable triangle for your body to balance on. Too close, and you're wobbly. Too far, and you're stretching. 6 inches is that pro-level sweet spot for max stability. And that's just one part of the equation. The second part of this placement rule is that the crutch tips also need to be 2 inches in front of your shoe. So you gotta lock this into your brain. 6 inches out, 2 inches forward. That 6x2 rule creates the perfect foundation before you even think about taking a step. If you get this wrong, every single move you make after is gonna be off-kilter. Okay, pillar number 3. This one addresses the single most common and most dangerous mistake people make. You absolutely must have a gap of about 1 inch, or roughly 2 fingers width, between the top of the crutch pad and your actual armpit. So why is this so critical? Because those pads are not armrests. You should never, ever, ever be leaning your weight on them. The second you do, you start compressing that delicate bundle of nerves and blood vessels in your axilla, which can lead to pain, numbness, or even some long-term damage. So if the weight isn't on your armpits, where does it go? Well, that brings us to pillar 4, the hand brace. This is basically the engine of your movement. When you grab that handle, your elbow should have a slight bend in it, right around 30 degrees. Now, that angle isn't for comfort, it's pure physics. It's what lets you fire up your triceps and shoulder muscles to get a powerful, controlled push-off with every single step. Straight arms mean no power, too much bend, and you're unstable. 30 degrees is the magic number.
So once you've got that perfect fit dialed in, it's time to actually move. But it's not as simple as just walking. Nope. Depending on your injury, your doc is going to prescribe a specific walking pattern, or what the pros call a gait. And using the right one is absolutely essential for a safe and fast recovery.
First, let's just clear up something that confuses a lot of people. The difference between non-weight-bearing, or NWB, and partial weight-bearing, or PWB. They might look kind of similar, but the key difference is all about your intent. NWB means 0, and I mean 0 ground contact. That injured leg is floating. PWB, on the other hand, means you're intentionally touching that foot to the ground, mostly for balance, and bearing just as much weight as feels comfortable. It takes a lot more body awareness. So, with those ideas in mind, here are the main gaits. The most common one for NWB is the 3-point gait, where you swing your body through. For PWB, the injured leg just steps to the crutches. If you've got injuries on both sides, you might use a single gait, where the opposite crutch and foot move together in a nice rhythm. And for anyone needing maximum stability, there's the 4-point gait, which has the perfect nickname, the Frankenstein walk. Each point, crutch, foot, moves one by one. It's slow, but you are not going to fall.
Hey everyone, it's Sarah, the registered nurse, RN.com, and today we're going to demonstrate how to do the 3-point gait while using crutches. And this is where they move both crutches and the injured leg together at the same time, and then they will move the non-injured leg.
So for the partial weight bearing, when you're now able to put a little bit of weight through it, what we're going to do now is you're going to always move the injured leg with the crutches. So when you advance the crutches, you're going to move forward like that. And then based on where you're at with the partial weight bearing status, so it could be 20%, it could be 50%, you're going to just put roughly that percentage of weight through the injured leg, and then the rest of the weight you're going to absorb through your arms and the crutches. But the crutches and the injured leg should always move together.
One mistake that people typically make when they're using a crutch or some other assisted device on one side only is they tend to put it on the same side as the affected leg, whereas you would want it on the opposite side. That helps you maintain more normal gait pattern and gives you more balance. So in this situation right here, my left leg would be the affected side. As I'm walking, the crutch again is going to go with the affected leg.
Hey everyone, it's Sarah, the registered nurse, RN.com, and today we're going to demonstrate how to do the 4-point gait while using crutches. So the patient will move the right crutch, which is, we'll say, the injured side. Then they'll move the left foot. Then they'll move the left crutch, and then they'll move the right foot.
All right, you've got the fit, you've got the gait for flat ground. Now it's time for the final boss, the real world. Learning how to conquer stairs and other obstacles is the ultimate test of crutch mastery. And this is where your technique has to be absolutely perfect to avoid a serious fall. When you're going upstairs, there's a really simple and effective way to remember it. Good leg to heaven. You always, always lead with your strength. So you put your weight on your crutches, step up with your good, uninjured leg, and once that foot is planted firmly, you shift your weight onto it and bring your injured leg and the crutches up to join it. Simple as that. And for going down, you just flip the logic. Bad leg to hell. See, you have to establish a stable base on the step below you before you move. So you place your crutches and your injured leg down on that lower step, get them planted firmly, shift all your weight onto your hands and crutches, and only then do you step down with your good leg. Getting the sequence wrong is a recipe for disaster.
Hey everyone, it's Sarah, the registered nurse, RN.com, and today we're going to demonstrate how to go up and down the stairs while using crutches. How does a patient navigate up and down the stairs while using crutches? Well, you want to keep these two straight, and what I'm meaning is which leg is going to go first up the step versus which leg is going to go down the step first. And to remember that, remember good up and bad down. So whenever a patient is going up the stairs, their good leg is going to go first up on the step, followed by the crutches and the bad leg, which will proceed and go up the step. Now, whenever they're going down the steps, they're going to move the crutches down onto the step. That'll help provide stability, followed by the bad leg, because the bad leg is going to go down, and then they're going to move the good leg down onto the step.
You know, this all brings us to a really crucial shift in how we think about this. I love this quote from our source material. It reframes the whole process. Using crutches isn't just some passive thing you have to suffer through. It's an active skill that you have to learn and practice, just like you would a complex move in any sport. And how do you practice a skill? You run drills. This is basically what a pro-level crutch obstacle course looks like. It tests everything. You've got zigzag paths for balance, steps and ramps for going up and down, avoiding objects to practice multitasking, and even a super narrow path to simulate a crowded hallway. This is what real competence with crutches actually looks like.
So really, the big takeaway here is pretty clear. We have to stop thinking of crutches as just a piece of equipment and start treating their use as an essential skill. Mastering these techniques isn't just about not falling, it's about empowering yourself, giving you a real sense of control over your own recovery. And that leaves us with one last, kind of provocative question to think about. Given how common injuries are, and knowing the very real risks of using crutches the wrong way, why isn't this kind of formal, dedicated training a standard part of care for every single athlete who has to use them? Just imagine all the falls, the setbacks, and the re-injuries that could be prevented. It's definitely something worth thinking about.